This is a contrast non-CT scan of a 63 years old female patient. She is a known case of hepatitis C. First, I will show you the cirrhotic morphology of liver. Please observe wavy outline of liver. This is a hypodense lesion involving upper part of right lobe of liver. This one here, it shows slight non-homogeneous enhancement. There is an area of altered texture in the upper part of right lobe of liver. I wish a triphasic CT was done. That would have better highlighted the total extent of the lesion. But this all is the area of altered texture, although only this part of the lesion is visible more clearly being hypodense. But this also appears to be the hepatocellular carcinoma. Now please observe the non-enhancing tubular channels in the vicinity of this hypodense lesion. These represent peripheral thrombosed branches of portal vein and not the dilated biliary channels. Now please follow these lucent channels downwards. This one here, this one here. These are traceable up to the levels of both branches of the portal vein. These are almost completely thrombosed. The thrombus extends into the portal vein itself, which shows mild to moderate luminal narrowing. This is the splenic vein, which is completely thrombosed, and then this thrombus extends into the upper part of spiromesenteric vein, which shows mild luminal narrowing. So in monophasic CTs, one has to be very careful and look very keenly upon the altered texture of liver. And these tubular channels, they should not be confused with the dilated intrahepatic biliary channels. And especially when these thrombi, they extend downwards to involve the portal venous channels, then the likelihood of all of this lesion being hepatocellular carcinoma is much more. Her alpha fetoproteins, they were also elevated. Now this is the coronal scan. Please follow these channels downwards, extending up to the portohepatis. Please see, although spleen is not enlarged, but just see the severity of portal hypertension by dilated veins along the lesser curvature of stomach and in the lower end of the esophagus. These all are the varicose veins, esophageal varices at the lower end of the esophagus. Although spleen is not enlarged, there is moderate ascites. Density of upper part of greater omentum is thickened, is increased. These are also the collateral venous channels. The increased density of greater omentum most probably is because of the venous congestion. The rest of the abdomen, apart from the moderate ascites, is essentially normal. This is a small cyst in right ovary. It is a thin-walled cyst, appears to be a simple cyst. There is no solid component along its walls, and this may represent a benign surface epithelial inclusion cyst.